हेलो एवरीवन, आई एम डॉक्टर सारिका जायसवाल, प्रैक्टिसिंग गायनेकोलॉजिस्ट इन इंदौर। आज हम बात करेंगे प्रेगनेंसी के कॉमन सिम्टम्स के बारे में। सबसे पहले मैं ये बताना चाहूँगी कि प्रेगनेंसी के 9 महीने को हम 3 पार्ट्स में डिवाइड करते हैं, जिन्हें 3 ट्राइमेस्टर्स कहा जाता है। फर्स्ट 3 मंथ्स, मिडिल 3 मंथ्स एंड लास्ट 3 मंथ्स. So when your test become positive, it is a moment of great joy in your family, but it brings with it lots of questions, lots of worries, lots of apprehensions. I hope with this video I will be able to solve some of your queries. uh, First we will go about the first trimester symptoms. So most common symptom of first trimester is morning sickness. सुबह के समय आपको nauseating और vomiting होती है. Most of the women feel this morning sickness in the morning, but some women may feel this symptom in the evening also. So both the things are normal. You can feel nauseating in the morning or in the evening. It is very normal for the normal pregnancy, and don't worry about it. To control this symptom, you can use some tricks. First important tip is you should not brush your teeth or drink water or tea immediately after waking up in the morning. You should have one sweet biscuit in the bed before getting out of the bed, and after taking this half an hour you can brush your teeth and you can have milk or tea, whatever you want. But tea should be with some solid snacks. Either you can have poha or paratha, whatever you like. This symptom is ginger. Ginger is very helpful in morning sickness. You can have ginger juice, or you can have ginger candies. These are available in the market nowadays. You can use those things. And apart from nausea, some women feel bloating, gas बहुत बनता है. It is normal for the pregnancy. For this, the important tip is you should avoid spicy and oily food, especially in night, and you should avoid junk food at all. Don't have junk food, cold drinks. You should not have these things. And you should have your meals in small portions and frequently. Don't eat much at one time. So these are the tips to control this most common symptom of pregnancy. Other symptom is constipation. Most of the women feel that they are not having their regular bowel movements. It is because of the progesterone hormone, which is in excess in pregnancy, and it reduces the normal peristalsis of the gut, and you feel constipation. The important tip to relieve this symptom is you should have plenty of water. Drink plenty of water and eat fiber rich diet. Like, you should have all the green vegetables, all the fruits, not juices. Eat whole fruits, and you should have sprouts. Next common problem the women face is breast tenderness. So, most of the women say that the breasts have become heavy and feeling pain in that, and some of the women may notice some milk secretions in that, some discharge in that. All these things are normal. For this, you have to support your breast with a tight bra, and that will solve your problem. And with the increasing duration of the pregnancy, the symptom will resolve by itself. Some of the women notice that instead of increasing weight, their weight is losing in initial 3 months. It is very normal. Don't worry about it. Because of the nausea and because of the altered taste, you are not able to eat properly, so that your weight may reduce in the first 3 months. Other most common problem, the most common trouble the women face is some lower back pain and some discomfort in the lower abdomen, some stretching in the lower abdomen. So all these symptoms are normal. It is because the baby is growing inside, the uterus size is growing, so there is maybe some stretching. So the important tip to avoid this symptom is you should maintain the proper posture during pregnancy. Okay, and you can do little light exercises in initial 3 months also, like you can walk, you can do some stretching exercises, you can do simple yoga. All these will help in the backache. And take proper rest. Okay, you should rest at least 1 to 2 hours in the day and proper 7 to 8 hours in night. Other change is skin changes. uh, Most women face that the acne are increased when she has conceived, and other may say that the acne has disappeared. So both the things are normal. Every women has different kind of skin, so they experience different problems. And for acne, nothing to be taken, no medicine should be taken. You can wash your face frequently with plain water without any soap. That's it. And in pregnancy there is pigmentation of the skin. You can have pigmentation over the face. You can have pigmentation, darkening of pigmentation means darkening of the armpits, inner thigh, groins. All these are normal things. So these are the common symptoms of the first 3 months. And after 3 months, some changes that women observe are these. First is the baby movements. Women starts feeling the kick of the baby, and the time when you will start having this will be different for every woman. And if this is your first pregnancy, it will start at around 5th month, around 18 to 20 weeks. But if it is your second or third pregnancy, it can appear early, before 18 to 20 weeks also. Other thing is baby bump. The women are really concerned that the baby bump is not seen, and my belly is flat till now. It is also different in different women. If you are thin, it will appear early at around 5th month. But if you are overweight, obese, it can show up a little later. So don't worry about it. Just ask your doctor whether your baby is growing or normally or not. He or she will solve your query. The After 3 months, the breasts become bigger. They become more sensitive. They may become tender. You may feel some discharge, and the important observation is the areola size increases. It becomes darker. So all these things are normal. By the second trimester, you should start massaging your nipples and areola, so that they will not crack when you feed your baby. And the darkening of the skin may increase. You may feel more pigmentation on your face, and there is a dark line appearing on the abdomen, in the middle of the abdomen, vertical line. It is known as linea nigra, and it is normal. And you may start noticing stretch marks over the abdomen. So I would like to clear that the stretch marks are not because of your scratching. These are because of the stretching of the skin, because the baby is growing, and your skin is getting stretched. So it will appear because of the stretching of the skin, not because of the scratching of the skin. And for these, you have to just moisturize your skin properly. You can use any of the moisturizer, any of the bio oil, coconut oil, or even the desi ghee you can use. And your doctor can advise you some other creams to apply in 3 to 4 times a day, and it should be started from 4th to 5th month and should be continued after delivery also. Some women may have leg cramps or night cramps. In some, it may be mild, and you cannot notice. In some, it may be severe, that it is so bothersome that they cannot sleep in the night. It is because of the deficiency of calcium and magnesium, and it can be avoided by simple stretching exercises. You can have hot shower before sleeping, and you can simply massage your legs, and you can apply some pain ointments, pain removing ointments over the counter. And if it is really bothersome, you should ask your gynecologist, and we will give you some medicines of calcium, magnesium and vitamin, and it will control your leg cramps. And after 3 months and during the second and third trimester, the backache may increase, and it is because of the changes in your backbone. Because of the tummy, the backbone is bent, and it can cause more backache. And to avoid this, you should do simple exercises in pregnancy, and you should continue your calcium and magnesium tablets sincerely, and you should have milk and milk products daily in your diet. And you can avoid this also by sleeping in the left lateral position and keep a cushion between your legs. Other common symptom, you may notice that the vaginal discharges increase during pregnancy. It may occur in first trimester and may occur in second and third trimester also. Because of the hormones, the vaginal glands increase the secretions, and you may notice some discharge during the pregnancy. It is very normal, don't worry about it. But if the discharge is curdy, if it is grayish, if it is foul smelling, if you are having fever with it, if you are having some urinary symptoms with it like burning in micturition or itching, or pain in micturition, pain during passing urine, so then it is not normal. You have to consult your doctor. It is because of the infections, and this vaginal infection or urine infection is a most common cause of preterm deliveries, and should not ignore this, and you should consult your gynec and take proper treatment for this. During pregnancy, the dental cleaning and dental hygiene is very important. You should brush your teeth twice a day, and you should gargle, or you should floss the teeth every time you eat or drink something. So these are the common symptoms and problems a woman face during the pregnancy, and most of the time it is very normal, nothing to worry about it.